So you started playing tennis and you fell in love with it. You've got a group of friends that you meet, it gets you outside, it's great exercise, it's fun, but one day you grip the tennis racket and realize you're having pain in the elbow on the outside here. Tennis elbow is a really common injury with our amateur and junior athletes, especially with a lot of backhand strokes that we're using, and it can be really frustrating. In our office, we're going to take you through an exam to make sure that we are first finding out, is it the elbow or somewhere further up the chain that's causing the issue? And then we're going to go and address all of those issues we found on that exam. When it comes to the joint, we're going to look at the elbow itself, but we may look into the shoulder and the mid-back to make sure that all of these joints are moving through the ranges that they're supposed to. If those joints are restricted, you're going to find the movement somewhere else, and that usually ends up getting overworked. Then we'll go back and we'll address the soft tissue. The way we're going to treat the soft tissue will look different depending on you. If this has been something that's been sticking around for months at a time, this may be something that we may be using needling on. But if it's a fairly new injury, we may use myofascial release or the tool or another soft tissue therapy that we offer. Then we're going to go and do some exercises to make sure that all of the good work that we've done is going to stick. So let's take a look at a couple of those. Now we're going to do a self-mobilization for that elbow. You want to put the top part of your arm on the wall here, and then from there, holding on to a lacrosse ball, or at home you can just roll up a little dish towel to hold on to. You're going to grab onto the lower part of the arm with your other hand. You're working towards pointing your thumb down, so we want to work on extending the elbow, straightening it out, distracting it a little bit, and then helping turn that elbow down and squeezing that ball or that towel at the end. Come back out. Working on extension, turning that thumb towards the floor, and a little bit of distraction here as you squeeze the ball at the end. And that's gonna just help to mobilize that elbow joint for you a little bit. Now we call this our wrist flow, but there's lots of benefits for the elbows as well with this one. What we wanna do is go up on all fours. You're gonna try and turn the pits of the elbows forward as we do this. And then from this position, keeping those forward and elbows locked out, we're gonna rock forward until you feel a good stretch through the forearms. We really just wanna stretch, not pinching in the wrists or in the elbows. And you're gonna rock forward, hold for about a second or so, rock back, and repeat that for 5 reps. Then we'll take the hands and turn them over. Try to keep those elbows straight once again. Rock back. Same thing, you're gonna hold at that end range for about a second or so, come out of it, repeat that for 5 reps as well. Then we'll take the wrists and turn them over. Now we don't wanna irritate the wrists with this, so we're not putting a ton of pressure into them. But from here, we're gonna turn those bits of the elbows forward, and then you're gonna sit back. Hold that end range for a second or so. Repeat this one for 5 reps as well. Then you're gonna shake the wrists out, kind of get them ready to get back on load. And from there, we're going to come here. Try to keep your first knuckle on the floor. The further forward you lean into it, the more difficult this is gonna be. Turn those elbows forward, pits of the elbows forward, and then you're going to use your forearms to lift yourself up. We're gonna do 5 reps here as well. And this should be more of a burn in the forearms, like you're working the muscles, not so much of a stretch with this one. Now, these are a couple common exercises we'll use for tennis elbow, but it really depends on what we find in your exam. Your treatment needs to be tailored to your specific needs. So go ahead and get on the schedule so we can do an exam and find out what it is that your body needs, and then we can treat you based off of that.